IHT? IHT, good. Sounds good.
So hi Sumit, trust things are well with you. And I want to welcome you and everybody. We have to welcome everybody to yet another exciting India Health Talk edition. While I say yet another, it's only the second one. but, but it depends on how you look at it. And today I want to, I was, you know how these things are. I was just reading some things about contact tracing. And I realized that Aarogya Setu, which is our contact tracing app, has been around and has been doing reasonably well. And how I became aware that it's creating quite an impact is because in my apartment, some lady figured out that there was a COVID positive case just 1 kilometer away, and that created a lot of excitement for a couple of days this week, right? And I don't know what you've heard about it, and what are your perception about and your perspective on Aarogya Setu overall.
Sure. Good afternoon, Dr. Vikram. And though it's the second talk, I think it's a very engaging piece of topic that you have come across for today's talk. Okay, and let me begin by saying that the contact tracing apps have been effectively being used by governments across the globe. Okay, in helping to arrest the spread of the contagion. Now, in a very basic layman language, we need to understand how these apps work. So they operate on the principle of location mapping using GPS and Bluetooth. Okay, and there are actually two versions of it. One is the centralized version and the decentralized version. Okay, now in around 23 countries, there are around 43 COVID-19 contact tracing apps that have been launched, and out of those, 70% works on the centralized systems globally. So what is this centralized version? So this means that the location or the proximity of the tracing data, which is processed by the app, is funneled into a centrally run database or a server, okay, rather than being stored locally on the user's phone. Okay, now this database is, no process in guessing, is controlled by the government or a local health service. Now, two schools of thought here, there. The skeptics say that this storage of the data into a centralized database, which is run by the government, it is actually kind of hurting the privacy of the citizens. There are a lot of privacy advocacy bodies that have alleged such apps, especially the India one, which is the Aarogya Setu app, to have breached the privacy of a lot of citizens. It does not have a standard operating procedure, and they are downloaded without a supporting legal framework. So this issue, I think, is the center of the controversy around this app. Now, let me give you a stat. In India, this app has been downloaded by over 10 crore people in last 41 days.
Okay.
Making it the most downloaded contact tracing app in the world. So it itself speaks of the volume of the effect that it can bring in helping the spread. Though it has been made mandatory by government in many cases, like in offices, and now people who will be traveling via air, they have to download it for sure before entering into the airport. Okay, so there have been positives around it, but of course, the privacy infringement and the security is also an issue. So I have one question for you, Dr. Vikram. So what do you think of this? Like, these skeptics will always be there. There have been, in health data also, like when there is sharing of data across in EMR or in other forms like IoT or wearable devices, there has always been, such skeptics coming out. So do you think there is a balance, and as a citizen, we can let go of some data for the greater good?
Very interesting question. I didn't realize there were 10 crore downloads, so no wonder there's so much excitement over the app and its findings. So I was reading this report, I don't remember from whom, where they kind of analyzed countries that have done well against COVID versus countries that are still struggling, right? So if you see the countries that have done well, Taiwan, South Korea, India to a great extent, Sri Lanka, even China for that matter, how they handled the crisis once it became full-blown. The crux of the matter is the Asian countries have managed it better, while the Europeans and obviously North America has struggled. The reason why a lot of this report claims that the Asian countries have done better is because we have much wider definitions of what is privacy. And a lot of the privacy laws have not been strictly enforced, right? I mean, the three countries where privacy is very strong in Asia is Japan, Australia, and New Zealand. Australia and New Zealand, you know the state. Japan, obviously, you know, they are very strict about healthcare. So there were some concerns there. But overall, Asia has managed it better. Which brings me to the point I'm trying to make is when it comes to an epidemic or a pandemic like COVID-19, I think privacy is a trade-off. It's a trade-off. If I have to strictly, hey, I have to respect the privacy. Luckily, the India Data Privacy Bill, the draft India Data Privacy Bill had not passed since then. But that means we were governed by the instances of the IT Act, which are very loosely defined themselves, right? Uh, so legally, while the government found this loophole, I think because it's a pandemic, we have to find a way to suspend some of these. Otherwise, it'll be very difficult to figure out where the person is, where he's not. Number two, I think privacy is overall very overrated, in my opinion. There is a lot of school of thought that in the future you either pay for a content service, you pay for it with money, or you pay for it with your data. Right. So this is an instance where I paid for it for my data because India cannot afford to pay for such apps with their money. An app has to be run by somebody, right? You can't just say government is going to keep putting an endless, a bottomless pit of money. So I think if it's 10 crores, and I did not know that, if it's 10 crores, it's the largest contact tracing app in the world now today by number of users. I think the government's done a great job. But at the same time, there will always be people saying, hey, my privacy, my security, my this, my that has been affected. Mm-hmm. The other thing is, you know it, I know it, we've seen it over and over again. In healthcare especially, I don't think we are there as yet. So we have an opportunity to do digital health and all these things. If you look at the privacy and security, we are still very weak. So that is an overall area of concern, not just Aarogya Setu, it's every digital health platform I see.
Sure. I would beg to differ on one point here that, of course, I'm
that's what we are here for. We are here for controversy, right?
True. See, I relate to you in terms of letting off the data for the greater good, for the control of epidemic. I'm fine with that, but I'm not ready to trade off my data for any other services. Now, that data can bring about by breaching the security. Now, the data that we are talking about through this app or any of the contact tracing app that you download, there are ways that these data can be used. Okay, one is one typical way where like a hacker can sell your data to a medical company. Like you can get a data where you can know that these are the people, diabetic people in a particular area, that can be sent, sold to a medical or pharmaceutical company or medical device company. Then the second one, which I feel more dangerous, is that it can be used by the government for any of the purpose, and there are no terms and conditions, as you said, security framework or regulations, which says that such data cannot be used by government for any of the purposes, and there's no law book for the app as well. So here I feel that if government wants to gain the trust of the people, they should maybe enforce such kind of rules and regulation. Plus, for an example, recently UK and I think Singapore also, they made the source code of their app open. Like it's open for researchers and ethical hackers to go through it and identify any of the flaws in it. Okay, and these steps helps to gain the trust of the people. But India didn't do that. Many of the other countries haven't done like published their open source, to the outside world. Such steps, if taken, I think people would be very much open and trust such apps.
That's a good point. Very interesting observation. So they put the source code on open forum, is it? For for like a something like a community-based source code review.
Yes, absolutely. So it's an open source. A researcher, as I said, they can take a look what are the flaws, what are the positive effects, and anyone who can use that source source code can build an app for their own purpose. Like in different countries, they can use that technology and benefit their own citizens. And let me give you another fact that, when the app in India was launched, so MIT, which is well-known, renowned, and across the globe, they gave it a rating of 2 out of 5. Okay, and recently they downgraded the rating to 1 out of 5. Now they gave two reasons for it. One, it says that we are not applying the principle of data minimalization. So this data minimalization means that you have to have minimum data taken from the users of the app to get the desired results. So now when you use that app, I actually used it, and you see they will ask you a hell lot of things which are not actually required for contract tracing. Okay, so hence they downloaded, they degraded the rating from 1 out of 5. So if India can take steps to kind of mitigate these things, and of course other countries as well. India is not alone. There were some controversies in Singapore also. So for that reason, a country like Germany, they have not introduced an app till yet. They are very focused on the privacy of the citizens, and they are still taking cues and clues from different people, different countries, and then they are going to build it in the coming month, I would say.
Very interesting. MIT, I assume, is Massachusetts Institute of Technology, not Manipal Institute of Technology.
No,
Because I just wanted to be clear whether Manipal. I was just kidding.
No.
I know it is MIT in Boston, in Cambridge actually. So
Yeah.
data minimalization was one. What is the other reason you said? There were two reasons. They said
It was more of data destruction. So earlier the app said that earlier the app had the data within the server for a very long period of time. Okay, and there was no, I think, deadline given to it. Like after 3 months or 4 months, the data will be destructed automatically. Now I think they have introduced that after 60 days or 45 days, the data will be destructed. It will be deleted out of the server. Which is a good thing, so that government cannot use, or any other, or a hacker cannot use it for their own benefit. So they have reduced that now.
But interesting, though they have put in data destruction, they still downgraded the app, is it?
Yeah, because data minimalization. So earlier it was not there. Now they plan to do so, and data minimalization is an area that they see is a hindrance.
Yeah, I mean, the only thing will be once COVID is over, people should be encouraged to delete the app. I mean, if that's the one thing I can think of. While at the same time,
Mhm.
yeah, please go
Sorry,
ahead.
go ahead.
No, what
No,
I was saying.
I was
Okay.
I was just saying that, even the tech giants like Google and Apple, so they have come together. Those are rival companies, and they have come together on working on a coronavirus contract tracing technology that will be made available to governments around the world to help the spread of coronavirus. So collaboration is definitely visible across countries, across companies.
You said they're going to come out, or they have come out?
They are working on it. They are working on it so that it works on both iOS, Android equally. They will take care. They say that they will take care of all the privacy issues that are out, and it will be more abiding to the rules of security.
Oh, excellent. Okay, good. But I should give credit to the Indian government then. Brought out the app very fast. I think the speed at which they brought the app was brilliant. And if Google and Apple are still thinking about how to bring it out, and they will bring it out. Anyway, we are in for the long haul, but I think I learned something about Aarogya Setu myself. I was not aware of so many issues. The only issue I saw is that somebody in my apartment found out there was a COVID-19 case, and that created a bit of a panic. And though not in the apartment, it was about in the next neighboring condo. But good, Dr. Sumit, that was very insightful, and I hope people are using the app knowing what they're getting into, which is a lot of things that should be there are not there in the app.
Absolutely. Any tool that can help us, to control the spread, keep us safe, should be used. Of course, there will be some flaws here and there, but if we can overcome those things, I think it's good for the healthcare community.
All right. Thank you, Dr. Sumit. Have a great Sunday afternoon, and talk to you soon.
Sure. Thank you, Dr. Vikram. Have a great day.
Bye.